It cannot happen all at once. Control measures can only be lifted if the right public health measures are in place, including significant capacity for contact tracing.
That is Dr. Tedros, the Director General of the World Health Organization, talking about the importance of contact tracing. Contact tracing is when health officials reach out to people who've come into contact with someone who's tested positive for COVID-19, and then those people can self-isolate, monitor their symptoms, and get tested. It's a really good way of stopping a virus from spreading, and some countries have found ways to do it quickly and accurately, but Canada's still figuring out the right approach. The thing is, we have to nail contact tracing before we can safely reopen our economies, and it may sound simple, but it's not. It's difficult to do without the help of technology, and that technology comes with a lot of built-in privacy concerns. Alberta just launched the first contact tracing app in Canada this week, and in Ontario, Doug Ford is calling for a national strategy on contact tracing, so we thought it was a good time to do an explainer. How is contact tracing done? What makes it so difficult in a pandemic? And how do we get it right? Today, I'm talking to Cynthia Carr. She's an epidemiologist and health policy expert based in Winnipeg. I'm Tamara Kandaker, and you're listening to Wait, There Is More. Cynthia, rapid contact tracing is one of the key things that we have to have in place before we start to lift restrictions, based on everything that I've heard from experts, obviously along with testing and increased healthcare capacity. And I want to start with your perspective on this. How crucial is our ability to do contact tracing to reopening economies and going back to normal life? And on what scale do we have to be able to do it?
Well, ideally, because this virus has a very tricky and effective strategy of being asymptomatic for quite a long time, up to 14 days, but it can still be spread, ideally, people are notified within 24 hours if they have been exposed and if they might be carrying the virus so that they can change their behaviors to protect other people. Because the goal is to stop that virus's ability to spread. And the only way to stop it spreading is for people to know as early as possible that they've been exposed so that they can be careful and then find out if in fact they've been infected. And then of course they're going to be even more careful and monitor their own health as well as maintaining isolation from others. But with that, we need to have the best capacity for testing and reporting back, because bringing in more resources for contact tracing is not going to be effective unless we know that we can have sort of a 24-hour turnaround time on testing. So we need to sort of balance what we know now in terms of our highest risk population and where we want to focus in terms of screening and diagnostic testing and contact tracing. Those are three different sort of pieces of the puzzle.
So the idea is that tracing helps contain the spread by warning everyone who was in contact with an infected person that they're at risk of having the virus so that they can isolate and get tested and reduce the likelihood that they would infect other people.
That's right. So instead of being reactive, this is the proactive part of it. So proactively finding people who are at risk of exposure.
Right. And contact tracing isn't new. This has been around for a long time. And can you tell us a bit about how it's been done in the past?
So typically contact tracing would be used for other infectious disease. So things that we might know about would be sexually transmitted infections such as chlamydia and gonorrhea. There's contact tracing required. And then tuberculosis is another example of a highly infectious respiratory disease. Very small number of cases in Canada, but it is in Canada. And because it's so serious and infectious, contact tracing is required for tuberculosis as well. So Typically what happens is that the individual is tested, and once they are identified as positive, then there would be an interview with that individual. For example, if they're tested positive for chlamydia, to have a respectful interview with the person and talk about why it's important to know who the partners are, because there are diseases just like this where many people are asymptomatic. So the difference, obviously, with a sexually transmitted disease, even though we have over 100,000 cases of chlamydia often diagnosed every year, and that's a lot of people to interview and contact trace. But the difference is with that kind of an infection, you would know how many people you've been in contact with in a sexual manner. And not in every case, but in many cases, you're able to identify who the other people are that you've been in contact with and how to reach them. But in a respiratory illness, potentially with something like COVID-19, that's a whole different situation in terms of identifying who you've been in contact with and what exactly do we mean by, quote, a close contact. So it's a whole different scenario in terms of contact tracing, in terms of from the case, how many potential other people might be involved.
Public health workers currently identify who may have come into contact with a person infected with COVID-19 by asking questions of the case and relying on their ability to remember everywhere they have been in the past several days and who they were near.
So it's harder because you're potentially spreading it to so many other people compared to an STI where your sexual history is probably limited to way less people.
That's right. And typically a sexual encounter is something that you would remember or recall that had happened. On the other side, if we're talking about COVID-19, we're still learning about exactly all of the disease transmission. So that is, how is it spread? Is it possible that it's in the air? How near or far does somebody need to be from you? But also to the point of remembering. If somebody said to me in the last 2 weeks, tell me where you've been and who you've been around, and it's not specific to an event like an intimate activity or something that I would remember, there's lots of opportunity just for forgetting.
We ask them to identify when their symptoms may have started. And then what we do is we turn back the clock 48 hours from that time, and we find out everyone they've been in contact with from 48 hours previously.
And remember that this can also be a high stress situation for someone. They're feeling anxious and concerned. So just again, the anxiety of trying to remember can impact, and then just trying to remember your daily activities. Where was I 2 weeks ago? What stores did I go to? Was I at the gas station? And we know again from our data that most of our cases are in vulnerable, elderly, high-risk groups that may have other challenges with recollection. But on the other side, many of them are in long-term care facilities and they haven't really gone anywhere. So that might make it easier to connect with who they've been in contact with. So again, with resources, where do we need to focus?
Right. So in the past, contact tracers were a pretty small part of a public health department, right? But now there's this ongoing effort to scale up at the federal and provincial levels. Governments are looking for as many people as possible to do this kind of work.
So we are developing a surge capacity to make sure that if more contact tracers, for example, are needed, that they can be accessed.
I've heard medical students and nursing students, health inspectors for restaurants, all kinds of people are being tapped to help with contact tracing. I'm wondering if you can tell us a bit more about that effort and what it's been like for the people who are working in contact tracing right now. Like, are they overwhelmed? How many calls are they doing per day? Can you tell us a bit about that?
Right. So to your point, one of the primary functions of public health is the control of communicable disease. So public health is actually very well versed in setup, in contact tracing, in training people to contact trace. And as I said, we have over 100,000 chlamydia cases a year. But you're right, because of the potential spread of numbers of contacts, we've amped up resources and brought in less well-trained people, but the commitment to health, as you had mentioned, medical students. So it would depend on what level of information they have in terms of how many people could they contact a day. Are they contacting only the primary people in the person's life, which again makes it easier because they probably have a name, they have a phone number, and they probably have somebody that's open to talk to them, that's reachable. But the challenge is the highest risk individuals are often hard to find. So how do you track down people that might be vulnerable because they don't have housing or they're in challenging situations? So those are the people that would take more time to track down, but they might be more transient and at higher risk of spreading the disease to others. So we don't have good data right now on the numbers of calls per day that people are doing, but there's certainly a huge investment in training and hiring of staff. And that training has to pertain to respectful communication, culture, language, respect of privacy. How do you ask questions so that you get back answers that are useful? And how do you manage the emotional response of that person that could be quite fearful on receiving a phone call from somebody that they don't know, telling them they might have been exposed to a disease that, in spite of all public health efforts, many people still don't quite understand, or they're very afraid because, of course, we hear about the worst case scenario. So there's a lot that goes into those contact tracing phone calls beyond just, you might have been exposed, here's where I need you to go for a test, or here's a resource to monitor your own symptoms.
Yeah, I imagine lots of, I guess, like you said, cultural sensitivity and sort of being able to build a rapport with people very quickly.
That's right. It can be very lengthy and time consuming. So with, over 60,000 cases in Canada, you can imagine the resources that would be needed.
Right. And then as restrictions are lifted and we start leaving our houses, people are going to start having contact with way more people. So is it logical to assume that contact tracing is going to become an even more difficult task?
Absolutely. And that's why there's contemplation about using apps, because exactly as we've discussed, how are you going to contact trace now when people are moving about and they don't know who they've been around, in line at Safeway, or touch the PIN pad when they use their Interact or Visa card, and, that wasn't wiped down and potentially they were exposed. There's so much more now than goes beyond just recollection. It's not just about recollection. It's about how do you let other people know, and being more specific. It's one thing to say, Cynthia was at Safeway on Saturday and she's a case. Well, how many thousands of other people were at Safeway on Saturday? We need to narrow it down to a time, to were you near Cynthia?
There are a lot of tech solutions that are being proposed. One that Apple and Google are working on together now is building something that would have your phone log when you're in contact with other people using the phone's Bluetooth capabilities.
Well, this practice has caught the attention of Google and Apple. The tech giants have announced plans to add software that would enable contact tracing in their devices, making it possible for government agencies to track the distance between phones using approved apps. But the idea, as you can imagine, is raising concerns over privacy.
And you get alerted if someone you were in close proximity to had tested positive for COVID-19.
So the idea is there is no central authority that is able to look up where everyone has been and when they've been there. They maintain a record of what they're hearing. There's something reported to a central server, but it's anonymous. If you get a positive test, then you can choose voluntarily to report your current status, and then other users who may have been near you and might be at risk can be notified.
And so I want to get your perspective as an epidemiologist. What do the apps need to be able to do in order for them to be helpful in containing the virus?
So obviously there's two very important aspects. One is the utility of containing the virus, and the other is the privacy protection of people. So with that, people must voluntarily agree to use the app. So we've seen that China, South Korea, and Singapore, for example, have used smartphone apps, as you said, to track people's locations. So Singapore, though, has been hindered by a low voluntary sign-up rate. People just weren't comfortable. They were concerned about their privacy.
Now, in Singapore, 20% of people downloaded a similar app. In Australia, that's at 12%. Here, AHS...
So as an epidemiologist, not only does that app have to be able to connect with the right distance of people, and as I've said, we're still learning about the potential for spread of the disease, but people need to understand how their privacy is protected, how the app is used, what's going to happen with their data later. And again, as an epidemiologist, this app is only going to be effective in the actual control of spread if there's quick turnaround with testing. But in terms of actually controlling spread, that app is a great IT aspect, but without the capacity to quickly test and report back the results, there's limited utility.
Yeah. You mentioned one thing, which is the low opt-in rate in Singapore. And that's one of the downsides that a lot of experts have pointed out, which is if people have to opt in to use the app, and it's very likely that we will in Canada, the apps are going to be voluntary. The government seems pretty reluctant to force this on people.
We're going to get that balance right. There are possibilities around using voluntary measures, around other things, but every step of the way, we will hold true to the values that mean so much to Canadians around privacy and security.
And there have been places like North Dakota, for example, where only 3% of people have downloaded the app that the state introduced. So what happens if people are not willing to use it, and how many people have to be willing to use it for it to be effective and make a dent?
So the minimal that I have seen is 60% opt-in rate from modeling to show where there could be a true impact in significantly stopping the spread. So 60% would be your minimal target. But we have to remember there's two components. One is voluntary sign up, but the other is something that we could call the, quote, digital divide. So, for example, I work primarily in Northern and First Nations communities. There are many communities where there is no cell service and there is no internet in the home. So people rely on Wi-Fi to connect. But if the places where people typically go for Wi-Fi, for example, the school or the band office or other sort of public areas are either still closed or have significant limitations on the numbers of people that can be there, that app will have no utility at all. And again, that might be for some of your highest risk populations that have overcrowded housing. So there's more opportunity for spread. There's less food security. There's higher rates of chronic disease. So again, you have people that are the highest risk, as we've already talked about in the long-term care facility, that might have the least ability to actually sign up. Either they don't have a smartphone or they don't have connectivity to be able to use it.
Yeah.
So there's both. And that's why, again, it has to always be a three-part approach in public health, which is ongoing education, action-based messaging, education about your signs and your symptoms. If you think you might be sick, what you should do. If you think you might be infected, even if you don't feel sick yet, what you should do.
We'll be right back. Can you give us an idea of what contact tracing for COVID-19 looks like in Canada right now at the federal level and at the provincial levels? And is it where it needs to be in order for us to reopen?
It's not the federal government's goal or really a possibility for the federal government to take on the actual contact tracing. That has to be done at the provincial, the regional, and the municipal level. What ideally would happen and has been asked for is that there be a national strategy. So the national strategy should say, here's the time within which people should be contacted. For example, they should be contacted within 24 hours. Then we make sure that the provinces can say, we still don't have the resources to meet those goals. So the federal government needs to be in charge of saying, what is the reasonable turnaround time for effectiveness? What tools do all of the provinces need to have? And what is the core set of data that must be collected? And then it must be up at the local level to say, how do we implement that? How do we hire? How do we train? How do we monitor how well we're doing? But there should be a minimal core, a minimal set that everyone across Canada must collect so that there's ability to sort of compare. And if people start to move across provincial boundaries, we want to make sure that that information and that connectivity still works.
Mm-hmm. Yeah, and this is what Doug Ford asked for, I think, earlier this week. He asked for a national strategy on contact tracing.
We need a national plan for contact tracing. Right now, each individual province is doing it, but we need a national plan, work with the federal government and all the provinces.
Can we just quickly talk about Alberta? So Alberta's contact tracing team has grown from about 50 tracers to 440 now. They also launched the first contact tracing app in Canada. It's been downloaded more than 100,000 times already.
Every time users pass one another, their phones record the encounter using Bluetooth. Encrypted data will be stored on the phone. Now, if one of those users tests positive for COVID-19, the user can upload their interactions to AHS, and a contact tracer would call the numbers the phone registered, telling them to self-isolate.
Can you tell me a bit more about the effort in Alberta and what you think about what they're doing there?
It sounds like already Alberta has a very good sign-up rate, and I really believe that links back to our conversation about that ongoing importance of engagement. And we've seen that Alberta has done an excellent job in Canada of testing. They've developed the capacity, as you said, to hire more staff to participate in the contact tracing, but they've obviously developed trust and an informed population so that people were on top of it quickly and willing to participate in using the app and trust their government, that we see that the public health messaging is here to protect us. We understand that without a vaccine or a treatment, it's up to us to do our part, which is to participate, to allow other people to know if we might be infected, but also so that we know as quickly as possible if we could have come in contact. And we know that this isn't an all for nothing, because we can already see that if I do need to be tested, it appears that I can. And I think this shows an example of what a great job of grassroots efforts, right? Just communicate, stay on top of the communication with the population. They will trust you. And then when you have the fancy new technology, people will be most likely to use it, but they're not going to use it if they don't trust you or if they don't believe there's a path to a solution or the resources that they would need as a result of information that might come of using that app.
Cynthia, thank you so much for explaining all of this to us. I'm looking forward to seeing how this all plays out here.
My pleasure, anytime.
All right, that's the show. And if you want to know more about some of the privacy concerns around contact tracing apps and some of the approaches that other countries have been taking, we talked about all of this on our episode from April 2nd called Should Canada Use Cell Phone Apps to Slow the Spread of COVID-19? So check that out. Thanks so much for listening. I'm Tamara Kandaker, and I'll talk to you tomorrow.